The Myeloma UK 9 OPTIMUM trial is a real novelty because this is the first trial in which we offer precision medicine for patients, in that we profile their tumors when the disease is newly diagnosed and then assign a different treatment if we find markers that indicate early progression or early relapse of the disease. So this is a risk stratified trial. We also call it the high risk trial. This is really the result of many years of research, and most recently of the research that we have done as part of the large Myeloma 11 trial, which is one of the largest trials that have been performed in myeloma. And we have looked at many genetic markers and evaluated how much they can predict whether the disease is likely to relapse early. And the analysis of several thousand patients led us to define a group of genetic markers that are particularly informative. So we found out and published that recently as well, that having any two high-risk markers together in the same disease, which we also call double hit, is unfortunately predicting that the disease will come back relatively early with current standard treatments. So these patients are really in need to have ongoing therapies, intensive treatments, and I think especially the duration of treatment is important for these patients, because we need to really exert pressure on the clone. We need to reach deep remissions and we need to reach long remissions. And that's what the Myeloma UK 9 trial is designed for. So newly diagnosed patients, even if the disease hasn't been confirmed, they can have their bone marrow sample sent to us at the Institute of Cancer Research. And we work together with the University of Leeds. We analyze the sample actually with genetic markers and also with gene expression profiling. That's something that in Europe is not widely spread, and we thought that it would be very worthwhile investigating that, because we saw the power in our analysis of myeloma 11 as well for that. And if either of the two markers shows that the disease has a high-risk marker, then we offer the patient a novel combination treatment. So they can then get daratumumab, Velcade, Revlimid, dexamethasone, cyclophosphamide all together up front, which we think is one of the probably most effective treatments for this type of disease. We follow them up, and we have a really vital collaboration within the UK, which is really good. We have central laboratory analysis for minimal residual disease, MRD, and that's again building on a lot of experience. Roger Owen is leading this laboratory in Leeds. So that this will provide an early readout, because we can look at how patients are responding, and that's built into the trial, that we can actually look very early on whether these patients are responding better with this novel regimen than previously the patients that were treated on the Myeloma 11 trial. So there's lots of innovation, and we hope that we can really offer patients a lot here that is ultimately the result of a lot of research that has been going on in the past. So I think we're very grateful that there is such a research atmosphere in the UK, and that so many patients have been willing to give samples for the past trials, because that's now the information that we're drawing from to give back to the patients that are now newly diagnosed.